month of September is dedicated to raising awareness for 8 different types of cancer. One of them is thyroid cancer. So that's what I'm here to talk about today. Hey, I'm Gina. I'm a registered dental hygienist and a proud Burst ambassador, and you're watching Burst TV. Dental hygienists are trained to detect abnormalities with your thyroid. During your head and neck exam, we are feeling for lumps, bumps, sore areas. Because the thyroid gland is right under the skin, changes in its size as well as its shape can often be felt or seen. Many cases of thyroid cancer are found early, thankfully, which increases the odds of successful treatment. And dental professionals can play an important role in detecting these nodules, enlargements of the thyroid gland, anything that might contribute or be a sign of thyroid cancer. The not so fun fact though, only about 25% of dental hygienists actually provide this head and neck exam. So make sure that you ask your dental provider to do this head and neck exam for you. But what about in between dental visits? What can you look for that might be cause for concern? A new lump, bump, or nodule that can be felt through the skin on your neck area. Also, a feeling that close, tight-fitting shirt collars are feeling kind of different or too tight. Another thing you might look for is a change in your voice, like increasing hoarseness. Constant difficulty swallowing could also be a sign, or swollen lymph nodes in your neck area. Another sign could be pain in your neck or your throat that's not going away. What are some causes of thyroid cancer? Thyroid cancer happens when cells in the thyroid itself develop changes in their DNA. A cell's DNA contains the instructions that tell the cell what to do. These changes, doctors call them mutations, tell the cells to grow and keep growing, multiply rapidly, and they keep on living when healthy cells would naturally be dying off. The accumulating cells form a mass called a tumor. The tumor can grow to invade nearby tissue and can even spread or metastasize to the lymph nodes in the neck. Sometimes the cancer cells can spread beyond the neck area to the lungs, the bones, other parts of the body. For most thyroid cancers, it's really not clear what causes the DNA changes that cause the cancer. There are quite a few types of thyroid cancer, honestly, too many to talk about today, but here are some risk factors. Number 1, female sex. Thyroid cancer occurs more often in women than in men, and experts think that it may be related to the hormone estrogen. People who are assigned female sex at birth generally have higher levels of estrogen in their bodies. Another risk factor, exposure to high levels of radiation. Radiation therapy treatments to the head and neck actually increase the risk of thyroid cancer. And as a side note, you might be wondering if dental x-rays contribute or increase your risk for thyroid cancer, and the quick answer is no. You get about the same amount of radiation from a round-trip cross-country flight as you do a full mouth series of digital x-rays. The amount of radiation exposure that you get from a digital dental x-ray is very, very low. Another risk factor though, certain inherited genetic syndromes. Are you ready for these? Familial medullary thyroid cancer, multiple endocrine neoplasia, Cowden syndrome, and familial adenomatous polyposis. Like any other cancer, thyroid cancer can spread to other parts of the body. If I leave you with just one little bit of advice, always talk to your medical doctor. If anything doesn't feel right, if you're finding nodules, if you're having pain, if your voice is changing, these are all signs. So make an appointment, talk to your doctor, ask your dentist to do an oral cancer screening for you. As always, thank you so much for watching Burst TV. Please leave me a comment. Let me know what you want to know about next. And don't forget to subscribe because we have new videos coming out every week for you.